segment is sponsored by VCU Health Hume-Lee Transplant Center.
April is National Donate Life Month. We're joined today by Dr. Marlon Levy, Director with the VCU Health Hume-Lee Transplant Center. Doctor, it's great to see you.
Good morning, Jessica.
Thank you so much for making time. April is an incredibly important month. Of course, you're doing incredibly important work the whole year through, but this is a month that you take time to really recognize the importance of making that commitment to donate life.
It is. Everything in transplantation really hinges on the generosity of the organ donor, the organ donor's family, the person who is healthy and donates a live organ, in the case of kidneys and partial liver. So this is absolutely an important month for us, and to remember where it all comes from, if you will.
And during this time of complete not lack of normalcy for so many of us, it's especially important to make time to recognize that National Donate Life Month is happening. And why is it so important this year, really, to keep this top of mind for everyone?
Well, we as everyone are really struggling with what's the best way forward. How do we not bring things to a screeching halt, or perhaps another way of saying it is, what would the consequences be of bringing things to a screeching halt in my world, in organ transplantation, and what would happen to those patients who literally are dying for lack of a transplant, or whose lives are at high risk because, for example, they are in kidney failure and dependent on a dialysis machine. So like everyone else, I'm sure the times that we're living through really heightens our sense of what we're doing, why we're doing it, and are we approaching our situation thoughtfully and carefully.
Are transplants still occurring at VCU Health?
Transplants are absolutely still occurring at VCU Health. So we've had guidance from the federal government, from our professional societies, Medicare, which is the agency that has a big voice in transplantation. Early on issued directives that there are certain things in healthcare that simply had to continue. One was the care for the trauma patient, the acutely injured, which is understandable. The other was for a patient who had a threatened limb loss, who had some, for example, vascular catastrophe where they might lose a leg. And then the third was transplant, and understandably so. Patients, again, are dying for lack of an organ. And patients who are on wait lists, if they don't get transplanted, they will die for sure. Particularly in the case of the liver patient or the heart failure patient, and even kidney patients. It's quite clear that even though a kidney transplant may not be immediately life-saving in the sense that we have a backup system, dialysis. It's clear that long-term survival and quality of life are vastly improved with kidney transplantation. So I think that's what's behind the guidance for us in the transplant world to keep going as best we can and as carefully as we can.
Dr. Levy, we have about a minute and a half left, and there are folks watching today who may be motivated to give this gift of life, or were already considering it. What can you share with them? How can people continue to help during these different times?
Well, thanks for mentioning that. I think it's as it always is. It's important for all of us to be aware that organ donation is an incredibly important gift, and to keep that top of mind should that ever become a factor in our lives. And certainly for patients who are healthy enough to donate organs, kidneys, for example, we certainly want to consider that, and our patients want to continue to consider that.
I visited the page earlier today, vcuhealth.org/transplant, and you have an incredibly comprehensive frequently asked questions page there so that folks can learn more. And that's a great place to start, but definitely don't hesitate and get in touch with the team.
Absolutely. I think that's the clear message. We're working, we're open, we're saving patients' lives as best we can. We are approaching this, as is everyone, thoughtfully and carefully, but certainly the work has to go on.
Well, Dr. Marlon Levy, Director with the VCU Health Hume-Lee Transplant Center, thank you so much for making time, and thank you for the work that you're doing.
Well, and thanks for highlighting this topic. It's very important. Thank you again.
Absolutely. April is a critical month, National Donate Life Month.
VCU Health Hume-Lee Transplant Center is located at 1200 East Marshall Street right here in Richmond. Please give them a call at 804-828-4104. Visit their website at vcuhealth.org/transplant. Patient COVID-19 FAQ is also available. Find them on social media too. Facebook, VCU Hume-Lee Transplant Center. On Twitter at VCU Transplant and on Instagram at VCU Transplant.